بسم الله الرحمن الرحيم. هذه المحاضرة حنشرح ال internal causes of pruritus or itching. راح ناخذ بصورة عامة الديزيز اللي تسبب itching والchronic kidney disease نشرح عنها والliver disease والبوليسايثيميا vera. هسه عندنا ال internal causes of pruritus may be present as a symptoms in a number of internal disorders. The intensity and duration of itching vary from one disease to another. The most important internal causes of itching include the following: liver disease, especially obstructive and hepatitis C, with or without evidence of jaundice or liver failure, renal failure, diabetes mellitus, hypothyroidism and hyperthyroidism, hematopoietic disease, example iron deficiency anemia, polycythemia vera, neoplastic disorders or disease, example lymphoma, especially Hodgkin disease and cutaneous T-cell lymphoma, leukemia, melanoma, and internal solid tissue malignancies. Internal organ cancer may be found in patients with generalized pruritus that is unexplained by the skin lesion. However, no significant overall increase of malignant neoplasms can be found in patients with idiopathic pruritus. Other causes: intestinal parasites, carcinoids, multiple sclerosis, AIDS, connective tissue disease, particularly dermatomyositis, neuropsychiatric disease, especially anorexia nervosa. The pruritus of Hodgkin disease, it is usually continuous, and at times it's accompanied by severe burning. The incidence of pruritus is 10 to 30%. It is the first symptoms, or the pruritus may present as first symptoms of this disease in 7% of patients. The cause is unknown. The pruritus of leukemia, except for chronic lymphocytic leukemia, has tendency to be less severe than in Hodgkin lymphoma. يعني Hodgkin lymphoma أكثر severe من اللوكيميا عدا الكرونيك lymphocytic leukemia. Management: complete history, thorough physical examination. Laboratory tests include the following: CBC and differential, thyroid, liver, and renal function, fasting blood glucose, hepatitis C serology, HIV antibody if risk factors are present, urinalysis, stool for occult blood, serum protein electrophoresis, chest X-ray evaluation. A biopsy for direct immunofluorescence is occasionally helpful to detect dermatitis herpetiformis or pemphigoid. The presence of eosinophilia on the CBC is a good screen for parasitic disease. But if the patient has been receiving systemic corticosteroid, blood eosinophilia may not be a reliable screen for parasitic disease, and stool samples for ova and parasites should be submitted. Additional radiological studies or specialized tests are performed as indicated by the patient age, history, and physical findings. The treatment of itching of systemic disease or treatment of underlying disease, example treating the cancer, replacing the thyroid hormone in hypothyroidism, will relieve the pruritus. Sometimes disease-specific therapies can exacerbate itching during a treatment. For example, in cancer patients treated with biological agents such as anti-epidermal growth factor receptor monoclonal antibodies ممكن هذا هو الدراج يسوي له itching. نحكي على chronic kidney disease. Chronic kidney disease is the most common cause of pruritus, most common systemic cause of pruritus. هاي عليها MCQ. 20 to 80% of patients with chronic renal failure have itching. The pruritus is often generalized, intractable, and severe. However, dialysis-associated pruritus may be episodic, mild, and it may be localized to the dialysis catheter site, face, or legs. Patients on peritoneal dialysis have lower severity of pruritus than those on hemodialysis. Mechanism of pruritus in patients with chronic kidney disease is multifactorial. اللي هي ممكن include cirrhosis, secondary hyperparathyroidism, increased serum histamine levels, hypervitaminosis, increased vitamin A, iron deficiency anemia, neuropathy have been indicated. Sometimes the complication of chronic kidney disease may cause pruritus. Example, acquired perforating disease, lichen simplex chronicus, or prurigo nodularis. Treatment, emollients. Many patients have concomitant cirrhosis, and aggressive use of emollients, including soaking and smearing, may help. اللي شرحناها بيجي المحاضرة. Gamma linolenic acid cream, 1 by 2 per day, was effective, and as one may use baby oil. Gabapentin, giving 3 times weekly at the end of hemodialysis session, can be effective, but it's renal excretion. So the dose should be decreased in renal disease because renal excretion is decreased in the patient with a chronic kidney disease. So the initial dose of 100 milligram after each session with a slow upward titration is recommended. Phototherapy, a mainstay of chronic kidney disease-associated pruritus, has been narrowband UVB phototherapy. يعني هذا سابقا إنه هو mainstay treatment, but a randomized controlled trial failed to confirm its efficacy. Maybe broadband UVB is best in patients with a chronic kidney disease. Naltrexone, topical tacrolimus, and ondansetron also were reported to be useful in the initial trials, but subsequent studies indicated these agents are ineffective. Nalfurafine, 5 microgram once daily after supper, يعني بعد العشاء, has demonstrated improvement and was relatively well tolerated over a 1-year study. Thalidomide intranasal butorphanol and intravenous lidocaine are these practical options. Renal transplantation will eliminate pruritus. Biliary pruritus. Chronic liver disease with obstructive jaundice may cause severe generalized pruritus. 20 to 50% of patients with jaundice have pruritus. Disease أو liver disease أو biliary disease associated with pruritus اللي هي intrahepatic cholestasis of pregnancy, primary sclerosing cholangitis, hereditary cholestatic disease such as Algili syndrome اللي هي هذه syndrome تبدي عادة بالinfancy or early childhood affect the liver and the heart. Primary biliary cirrhosis, hepatitis C may be associated with pruritus as well. Mechanisms. Itching of biliary disease is probably caused by central mechanism. The pathophysiology is not well understood. It appears that lysophosphatidic acid formed by the action of the enzyme autotoxin on lysophosphatidylcholine اللي هو central. The serum conjugated bile acid level do not correlate with the severity of pruritus. The theory invoking endogenous opioid as the main cause has not been upheld. يعني ما عاد تعتمد إنه النظرية مع الأوبيويد receptor. بالنسبة للتريتمنت cholestyramine 4 to 16 gram daily. Pruritus of chronic cholestatic liver disease is improved with it. Rifampin 150 to 300 milligram per day may be effective, but it should be used with caution because it may cause hepatitis itself. Naltrexone up to 50 milligram per day is useful, but has significant side effect. If used, naltrexone should be started at 1/4 tablet اللي هي 12.5 milligram and increased by 1/4 tablet every 3 to 7 days until the pruritus improves. Sertraline, اللي هو من selective serotonin reuptake inhibitors, 75 to 100 milligram is another option. UVB phototherapy was effective in a small case series يعني عليه دراسات. Ursodeoxycholic acid is effective for pruritus and intrahepatic cholestasis of pregnancy, but not for the itching from other causes. Liver transplantation is the definitive treatment for end-stage disease and provided dramatic relief for the severe pruritus. And the primary biliary cirrhosis. Primary biliary cirrhosis occur almost exclusively in women older than 30. Itching may begin insidiously and may be the presenting symptoms in a quarter to half of patients. With time, extreme pruritus develop in almost 80% of patients. The disease is usually relentlessly progressive with the development of hepatic failure. يعني إنه حتميا راح يكون progressive with development of hepatic failure. Clinical features and association: intolerable itching, jaundice, أيضا striking melanotic hyperpigmentation of the entire skin. The patient may turn almost black except for the hypopigmented butterfly area and the upper back. Eruptive xanthoma, planar xanthoma of the palms, the xanthelasma and tuberous xanthoma over joint may be seen. Dark urine, stearia, and osteoporosis occur frequently. Several cases have been accompanied by scleroderma. Lab finding: serum bilirubin, alkaline phosphatase, serum ceruloplasmin, serum hyaluronate, and cholesterol values are increased. أيضا ممكن الأنتي mitochondrial antibody test is positive. Polycythemia vera: more than 1/3 of patients with polycythemia vera report pruritus. It is usually induced by temperature changes or several minutes after bathing. The cause is unknown. Treatment: aspirin has been shown to provide immediate relief from itching. However, there is an increased risk of hemorrhagic complication. ممكن bupa or narrowband UVB are also effective, and marked improvement is noted after an average of 6 treatments, with complete remission often occurring in 2 to 10 weeks. Paroxetine, 20 milligrams per day, produced clearing or near complete clearing in some studies, اللي هو من selective serotonin reuptake inhibitors. Interferon alpha has been shown to be effective for treating the underlying disease and associated pruritus.